Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is Eyes and Ears practice questions. Without delay, let's get started.
An older patient had ranibizumab injected into his eye for treatment of wet, age-related macular degeneration several days ago. He is now experiencing redness, light sensitivity, and pain. Which advice would the nurse give to the patient? 1. These are common side effects that should pass after a few more days. 2. Contact the healthcare provider immediately for possible eye infection. 3. Rest eyes as much as possible and wear sunglasses if lights are too bright. 4. Inform the HCP before the next treatment so that the dosage can be adjusted. The correct answer is 2. Contact the healthcare provider immediately for possible eye infection. Ranibizumab is an angiogenesis inhibitor that is directly injected into the vitreous humor of the eye. The purpose of the medication injection is to inhibit the growth of new blood vessels in patients who have neovascular age-related macular degeneration. The biggest concern about adverse effects of the treatment is endophthalmitis. This can be caused by bacteria, virus, or fungus. Redness, light sensitivity, or pain are signs of possible endophthalmitis that should be immediately reported to the provider. The nurse is supervising a new nurse who has just finished assessing a patient for redness and discomfort to the right eye. The new nurse documents visual acuity NA. Which action would the supervising nurse take? 1. Do nothing. The documentation is minimal but acceptable. 2. Ask her to explain the rationale for the documentation. 3. Reassess the patient's eye and vision to validate findings. 4. Suggest contacting the clinical educator for documentation tips. The correct answer is 2. Ask her to explain the rationale for the documentation. Asking the nurse to explain the documentation is a way of assessing her knowledge of documentation, her understanding of how the patient's report guides the focused assessment, and her understanding of the use of abbreviations. The nurse may have a good reason for charting NA, but a reader could misunderstand. For example, visual acuity NA could be interpreted as the nurse making a clinical judgment that assessing vision was not applicable for this patient. The documentation is not acceptable because the patient's report indicates that vision should be tested if at all possible. Redoing the assessment does not help the nurse to correct mistakes. Contacting the educator for assistance is an option that is based on assessment of her rationale. Which patients would be best to assign to the most experienced nurse in an ambulatory care center that specializes in vision problems and eye surgery? Select all that apply. 1. Patient who requires post-operative instructions after cataract surgery. 2. Patient who needs an iPad and a metal shield applied. 3. Patient who requests a home health referral for dressing changes and eye drop installation. 4. Patient who needs teaching about self-administration of eye drop. 5. Patient who requires an assessment for recent and sudden loss of sight. 6. Patient who requires preoperative teaching for laser trabeculoplasty. The correct answers are 1. Patient who requires post-operative instructions after cataract surgery. 3. Patient who requests a home health referral for dressing changes and eye drop installation. 5. Patient who requires an assessment for recent and sudden loss of sight. And 6. Patient who requires preoperative teaching for laser trabeculoplasty. Providing post-operative and preoperative instructions, making home health referrals, and assessing for needs related to loss of vision should be done by an experienced nurse who can give specific details and specialized information about follow-up eye care and adjustment to loss. The principles of applying an iPad and shield and teaching the administration of eye drops are basic procedures that should be familiar to all nurses. A nursing student is assisting an older patient who has decreased vision related to macular degeneration. The patient is alert, conversant, and cognitively intact. When would the supervising nurse intervene? 1. Student puts the call bell and personal items within reach and locates each item by guiding the patient's hand. 2. Student closes the curtains and turns off all of the lights at the end of the shift to encourage rest and sleep. 3. Student talks to the patient about family and asks, "So, when was the last time that you saw your uncle?" 4. Student assists during mealtime by opening packages and describing location of foods by using clock coordinates. The correct answer is 2. Student closes the curtains and turns off all of the lights at the end of the shift to encourage rest and sleep. For patients who retain some vision, the room should be well lit. Even at night, there should be a nightlight. Other options are correct actions. Words such as see, look, or view are parts of normal speech, and it's acceptable and natural to use these terms. The nurse is on a camping trip. A man who is chopping wood gets struck in the eye with a piece of debris. On examination, a wood splinter is protruding from his eyeball. What should the nurse do first? 1. Have the man lie in the back seat of the car and drive him to the emergency department. 2. Gently remove the piece of wood and place a sterile dressing over the eye. 3. Carefully rest a plastic cup on the orbital rim and tape it in place. 4. Flush the eye with copious amounts of clean tepid water, then check visual acuity. The correct answer is 3. Carefully rest a plastic cup on the orbital rim and tape it in place. Penetrating objects should not be removed or disturbed by anyone except an eye specialist because the object may be creating a tamponade effect. Removing or disrupting the object could result in additional damage to the eye. The man needs to have emergency care, and 911 should be called. But if there are no emergency services available, the man should sit in the back seat of the car with a seatbelt in place for transport to the nearest facility. If an eye has been cut or punctured, the bottom of a paper cup taped to the bones surrounding the eye can serve as a shield until you get medical attention. After a penetrating eye injury has been assessed and treated by an ophthalmologist, there is a possibility that based on the ophthalmologist recommendations, foreign body removal, flushing, and dressing application could be accomplished in the emergency department. However, penetrating objects frequently require surgical removal. Antibiotics and a tetanus immunization are administered before the patient is transferred to the operating room. According to evidence-based guidelines from the American Optometric Association, which patient needs to have an annual eye examination? 1. 18-year-old who is asymptomatic and has low risk. 2. 40-year-old who is asymptomatic and has low risk. 3. 55-year-old who is asymptomatic and has low risk. 4. 67-year-old who is asymptomatic and has low risk. The correct answer is 4. 67-year-old who is asymptomatic and has low risk. People 65 years or older are advised to have eye examinations annually or even more frequently, even if they have low risk. People who are 18 to 64 years old with low risk are advised to have eye examinations at least every 2 years. Examples of risk factors include family history for eye disease, systemic health conditions that affect the eyes, such as diabetes, racial or ethnic backgrounds with increased risk, such as African Americans, occupations that are eye hazardous, prescription or non-prescription drugs with ocular side effects, contact lenses, previous eye surgery or eye injury, and having functional vision in only one eye. After cataract surgery, which symptom needs to be immediately reported to the healthcare provider? 1. A scratchy sensation in the operative eye. 2. Loss of depth perception with the patch in place. 3. Poor vision 6 to 8 hours after patch removal. 4. Pain not relieved by prescribed medication. The correct answer is 4. Pain not relieved by prescribed medication. Pain may signal hemorrhage, infection, or increased ocular pressure. A scratchy sensation and loss of depth perception with the patch in place are common. Adequate vision may not return for 24 hours. Which finding should be immediately reported to the healthcare provider? 1. A change in color vision. 2. Crusty yellow drainage on the eyelashes. 3. Increased lacrimation. 4. A curtain-like shadow across the visual field. The correct answer is 4. A curtain-like shadow across the visual field. A curtain-like shadow is a symptom of retinal detachment, which is an emergency situation. A change in color vision is a symptom of a cataract. Crusty drainage is associated with conjunctivitis. Increased lacrimation is associated with many eye irritants, such as allergies, contact lenses, or foreign bodies. A patient calls the clinic and reports redness of the sclera, itching of the eyes, and increased lacrimation for several hours. What should the nurse direct the caller to do first? 1. Please call your healthcare provider. 2. Apply a cool compress to your eyes. 3. If you are wearing contact lenses, remove them. 4. Take an over-the-counter antihistamine. The correct answer is 3. If you are wearing contact lenses, remove them. If the patient is wearing contact lenses, the lenses may be causing the symptoms, and removing them will prevent further eye irritation or damage. Policies on giving telephone advice vary among institutions, and knowledge of the facility policy is essential. The other options may be appropriate, but additional information is needed before suggesting anything else. According to evidence-based guidelines from the American Optometric Association, which modifiable risk factor is the most important to emphasize during patient teaching to reduce the risk for age-related macular degeneration? 1. Initiate smoking cessation. 2. Take vitamin D and E supplements. 3. Eat dark green, leafy vegetables. 4. Wear protective eyewear as needed. The correct answer is 1. Initiate smoking cessation. According to the American Optometric Association, smoking cessation is the most important modifiable factor for decreasing risk for age-related macular degeneration. Consumption of dark green vegetables and use of vitamin supplements are recommended, but the evidence is less compelling. Use of protective eyewear is recommended to prevent eye injuries during active sports or hazardous occupations, but this preventative measure is not related to age-related macular degeneration. A client sustains a chemical eye injury from a splash of battery acid. The nurse should prepare the client for which immediate measure? 1. Checking visual acuity. 2. Covering the eye with a pressure patch. 3. Swabbing the eye with antibiotic ointment. 4. Irrigating the eye with sterile normal saline. The correct answer is 4. Irrigating the eye with sterile normal saline. Emergency care after a chemical burn to the eye includes irrigating the eye immediately with sterile normal saline or ocular irrigating solution. The irrigation should be maintained for at least 10 minutes. After this emergency treatment, visual acuity is assessed. Options 2 and 3 are not immediate measures. Phenylephrine, an adrenergic agonist, has been prescribed as a topical application for a patient who had intraocular surgery. Although systemic toxicity is unlikely, which adverse physiologic response is the concern? 1. Cardiovascular response, such as hypertension or ventricular dysrhythmias. 2. Renal response, such as urinary retention or urinary incontinence. 3. Respiratory response, such as bronchospasm or mucus plugs. 4. Musculoskeletal response, such as bone pain or joint stiffness. The correct answer is 1. Cardiovascular response, such as hypertension or ventricular dysrhythmias. Topical phenylephrine usually does not cause systemic reactions because the amount of absorption is very small. Cardiac responses are the concern. Other possible reactions may include sweating, tremors, agitation, or confusion. The nurse is preparing to administer a beta-adrenergic blocking glaucoma agent. Which statement made by the patient warrants additional assessment and a notification to the healthcare provider? 1. My blood pressure runs a little high if I gain too much weight. 2. Occasionally, I have palpitations, but they pass very quickly. 3. My joints feel stiff today, but that's just my arthritis. 4. My pulse rate is a little low today because I take digoxin. The correct answer is 4. My pulse rate is a little low today because I take digoxin. All beta-adrenergic blockers are contraindicated in bradycardia. Alpha-adrenergic agents can cause tachycardia and hypertension. Carbonic anhydrase inhibitors should not be given to patients with rheumatoid arthritis who are taking high dosages of aspirin. In the care of a patient who recently sustained blindness, which tasks would be delegated to assistive personnel? Select all that apply. 1. Counseling the patient to express grief or loss. 2. Assisting the patient with ambulating in the hall. 3. Orienting the patient to the surroundings. 4. Encouraging independence. 5. Obtaining supplies for hygienic care. 6. Storing personal items to reduce clutter. The correct answers are 2. Assisting the patient with ambulating in the hall, and 5. Obtaining supplies for hygienic care. Assisting the patient with ambulating in the hall and obtaining supplies are within the scope of practice of the AP. Counseling for emotional problems, orienting the patient to the room, and encouraging independence require formative evaluation to gauge readiness, and these activities should be the responsibility of the nurse. Storing items and rearranging furniture are inappropriate actions because the patient needs to be able to consistently locate objects in the immediate environment. The home health nurse discovers that an older patient has been taking her glaucoma eye drops by mouth for the past week. What should the nurse do first? 1. Obtain a prescription for tonometry so that her intraocular pressure can be checked. 2. Try to determine the frequency and the amount that she has been ingesting. 3. Ask her how she decided to take the drops orally instead of instilling them as eye drops. 4. Call the Poison Control Center and be prepared to describe untoward side effects. The correct answer is 2. Try to determine the frequency and the amount that she has been ingesting. Try to find out the amount and frequency that she has been taking the drops by mouth. This information will be needed when calling the ophthalmologist or poison control. A good follow-up question is to try to find out why she is taking the drops by mouth. She may be very confused, or there may have been an error of omission in patient education by all healthcare team members who were involved in the initial prescription. The nurse is assigned to care for a client with a detached retina. Which findings should the nurse expect to be documented in the client's record? 1. Blurred vision. 2. Pain in the affected eye. 3. A yellow discoloration of the sclera. 4. A sense of a curtain falling across the field of vision. The correct answer is 4. A sense of a curtain falling across the field of vision. A characteristic clinical manifestation of retinal detachment described by clients is the feeling that a shadow or curtain is falling across the field of vision. There is no pain associated with detachment of the retina. A retinal detachment is an ophthalmic emergency, and even more so if visual acuity is still normal. Options 1 and 3 are not specifically associated with a detached retina. For a patient who has multiple risk factors for primary open-angle glaucoma, which sign or symptom should be investigated as an early sign of POAG? 1. Loss of central visual field. 2. Seeing halos around lights. 3. Mild eye aching. 4. Loss of peripheral vision. The correct answer is 3. Mild eye aching. POAG develops slowly, and irreversible damage to the optic nerve can occur before any signs or symptoms are manifested. However, mild eye aching or headaches should be investigated as possible early signs of POAG. Loss of peripheral vision, seeing halos, and loss of central vision are late signs. A patient has a hordeolum on the right upper eyelid. Which intervention would the nurse recommend first? 1. Apply warm compresses 4 times per day. 2. Gently perform hygienic eyelid scrubs. 3. Obtain a prescription for antibiotic drops. 4. Contact the ophthalmologist. The correct answer is 1. Apply warm compresses 4 times per day. Warm compresses usually provide relief. If the problem persists, eyelid scrubs and antibiotic drops would be appropriate. The ophthalmologist could be consulted, but other providers such as the family physician or the nurse practitioner could give a prescription for antibiotics. The clinic nurse is preparing to test the visual acuity of a client using a Snellen chart. Which of the following identifies the accurate procedure for this visual acuity test? 1. Both eyes are assessed together, followed by the assessment of the right and then the left eye. 2. The right eye is tested, followed by the left eye, and then both eyes are tested. 3. The client is asked to stand at 40 feet from the chart and is asked to read the largest line on the chart. 4. The client is asked to stand at 40 feet from the chart and to read the line that can be read 200 feet away by an individual with unimpaired vision. The correct answer is 2. The right eye is tested, followed by the left eye, and then both eyes are tested. Visual acuity is assessed in one eye at a time, and then in both eyes together, with the client comfortably standing or sitting. The right eye is tested with the left eye covered, then the left eye is tested with the right eye covered. Both eyes then are tested together. Visual acuity is measured with or without corrective lenses, and the client stands at a distance of 20 feet from the chart. A visual acuity test is only one part of a comprehensive ophthalmologic examination. The goal of the visual acuity test is to determine clarity or sharpness of vision. The nurse is reviewing prescriptions for several patients who have disorders of the eye. Which medication prescription is the most important to discuss with the healthcare provider? 1. Timolol for open-angle glaucoma. 2. Cromolyn sodium for allergic conjunctivitis. 3. Atropine for acute angle closure glaucoma. 4. Ranibizumab for wet age-related macular degeneration. The correct answer is 3. Atropine for acute angle closure glaucoma. Atropine should not be used for acute angle closure glaucoma. Atropine causes dilation of the pupil, which impedes outflow of aqueous humor and increases intraocular pressure. This action could precipitate or worsen the condition.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.